Hello, and welcome to Community Pulse, a TV show on CAN TV about public health and wellness in Chicago. My name is Levi Moore, and I'm one of the 3 rotating hosts for Community Pulse, which is sponsored by the Hechtone Institute of Medicine. Today, my guests are Debbie Broadfield and Kristin Rubbelke. Debbie, Kristin, welcome to Community Pulse.
Thank you.
Thank you.
Okay, I always start, I try to frame the show. So guess what? Today we're going to talk about what happened in the Illinois General Assembly budget session, which recently ended. And so I do this every year. And as I mentioned, I'm on the Illinois Association of Free and Charitable Clinics board, and I'm co-chair of the advocacy committee. And I'm in this meeting with Debbie and Kristin. It's like, why don't I ask you? It's almost like we're doing a show just when we're doing our meeting. So all that big lead up is that Kristin and Debbie are the IFCC's Springfield lobbyists. And they do work with other associations in healthcare. Whatever. So, well, mini bios. Debbie, Kristin, go.
Thank you, Levi. It's great to be here today. So I'm Debbie Broadfield. I am a contract lobbyist and representing not only IAFCC, but many different healthcare groups, including the American Nurses Association of Illinois, the Illinois Society for Advanced Practice Nursing, the school nurses, the deans of the nursing programs. I also represent the Illinois Association for Behavioral Health and the nurse anesthetists too. So lots of healthcare related issues.
Kristin.
Hi, I'm Kristin Rubbelke. I am a licensed social worker and am right now doing macro level work, obviously lobbying at the state capitol for the free and charitable clinics. I have some senior homes, home health, hospice, home services, and then additionally the community care program, 708 boards, 708 mental health boards, hospitals, a variety of different mental health and behavioral health spaces. And as a social worker, it definitely speaks to my background and my passion. So thank you for having me on the show.
You're the perfect people for this show today. Well, let's start broad. Every General Assembly just tends to have a certain vibe to it, or there might be some overreaching factors that, I remember the first session without Mike Madigan, that truly did have a different vibe. And, when a new governor comes. So, was this a typical one? Was there a particular vibe to it or what?
For sure. I think that everything was budget focused, knowing that if there was a potential cost to it, an appropriation cost to it, it likely wasn't going to move forward. It was absolutely the main concern or vibe of the session, in my eyes, was budget.
Mm-hmm. Yep. And then in addition to that being the main concern, we had 2 legislative schedules, both the Senate and the House, that did not intertwine at all. And so what did that do to the vibe? It really reduced the amount of time, obviously, that both the Senate and the House were in together, which also reduced the amount of collaboration. And really, I don't know that any of us foresaw how detrimental that could be until getting towards the end of session. I mean, you saw huge pieces of legislation that were prioritized in one chamber but not in the other. That the other big pieces of legislation, again, that had one chamber had one idea and the other chamber said, I'm going to do something totally different. And then when it came down to the budget, even in the final hours of the budget, there was a lot less consensus than we typically see. And I think a lot of that had to do with the legislature not being in at the same time. So even though there was that big push for, budget focus, budget focus, budget focus, and the looming impacts of HR1, getting everybody together and on the same page was very difficult this year. So that really changed the vibes, more so than we've seen in previous years.
Well, and now I'm seeing it's like every couple of days, like there's a lot of finger pointing.
Mm.
It's like, well, why didn't this get done? Why didn't that get done? You're right. It just seems like the the core of it is that you weren't in session at the same time.
Mm.
Yeah.
Yeah, and it made those session days, those weeks with both chambers in session, which were great, and we as lobbyists looked forward to those weeks for us to be able to kind of bridge some of those conversations.
Mhm.
But it also made it a little bit more hectic because knowing that that was in the time that both chambers were in session, that's when a lot of other advocacy groups would have their lobby days, which
Yeah.
are very needed, but it
Mhm.
also caused, for the Capitol to be even busier, meaning even less
Mhm.
opportunities for some conversations that would be very important to have.
Mhm.
Yeah, it's like all this stuff. Well, so some friends who are called civilians, there's like, how in the world was Indiana able to pass that Big Bears bill and they couldn't do anything? It's like, yeah, Indiana moved it. What for Illinois would have been light speed, but that's just kind of how we roll.
Mhm. Mhm.
So with that, this show is about public health and wellness. So what happened in this session that, impacts people's health in Illinois?
So I would have to say, just generally, the budget was mostly considered a maintenance budget.
Mhm.
There really wasn't any huge, large investments into these spaces that we might think with the looming HR1 impacts coming up. We, the hospitals got a little bit of a cushion at the end of the day, but mostly spaces stayed fairly level. I know that the free and charitable clinics were one that were asking for more money, and they received the same amount that they got every other year, which we were very grateful for.
Which was great.
Very
I mean,
grateful.
quietly in my head, I was saying like, okay, be prepared to go down a little bit, folks.
Mhm.
And
And
when it came out, that's like, yeah, that works.
And there were spaces that saw significant cuts.
Mhm.
So that was, and programs that saw total cuts, different things like that. So, I do think that we need to be grateful where we see that. But we also know that the activity for some of these spaces is going to increase. We also know that staying level at spaces that are already underfunded and drowning feels more like a cut to certain spaces. So I think that there's a lot of work to be done in the upcoming sessions, but the budget, like I said, was mostly just a maintenance budget, and I think we're going to have lots of conversations, potentially even in veto session related to
Well,
it.
because we were following this dramatic play of, okay, the feds are not going to cover that. They're not going to cover that. They're not going to cover that.
Mhm.
And in Chicago said, well, the state should pick it up. It's like the state does not have money like that.
Mhm.
Um,
Absolutely.
so what did you hear about in terms of maybe what they have liked to do that they didn't get done in terms of healthcare specific?
Well, I definitely think that legislators, earlier you said, Levi, that there was some finger pointing going on. And I think that
Hmm.
comes down to, everybody's priorities are a little bit different, and
Hmm.
every legislator is having different districts, seeing different things and in the needs of their communities. So I definitely think, there will definitely some areas that were not hit, or even in
Hmm.
talking about the budget. Uh, the budgeted money for the free and charitable clinics, while at the end of the day, we were happy that it was flat and not cut, knowing this climate that we're in right now, we also know the needs are getting greater. And we are seeing more and more people that are not able to afford just basic health care. And so not is it only the Medicaid population, but it's those individuals who cannot, afford health insurance for their family, where maybe even previously last year they were able to. So I definitely think, from all of those standpoints, there was lots of frustration and concern that not enough was able to be done in plugging some of those holes. And as it was stated, that those conversations are going to continue and be at the forefront of discussions, because we know that ensuring that the healthcare and the availability and access of being a huge need for everywhere, but specifically in Illinois, is going to be of great concern in making sure that those that our citizens are cared for.
Mhm.
Now, I know like in the majority of my world, my public health, things were upended because a lot of the organizations did work that related to health equity.
Mhm.
And I'll never forget, I was in a conference room at the Illinois Medical District with some Westside United committee people. And they had these two attorneys from Rush Hospital come by to show us how to un-DEI our websites. So we were all looking at, program losses, but luckily for a lot of us, the Chicago philanthropic community stepped up, or if you were in a certain space, pharmaceutical companies stepped up. But now, looking at the other entities that you each represent, how did they do? Were there anything that significantly impacted them, positive or negative?
In
Because
terms
I know,
of the budget or legislature or
yeah, just because you cover a pretty broad field
Mhm.
of,
Yep.
I mean, it may not be a pun, but okay,
Yeah.
but
So I would say that one thing that did end up getting done that the legislature really put a fairly significant investment was the FRESH program. The FRESH program was a program that was just made up this year to help cover some of the SNAP recipients who are now going to lose their benefits because of those working requirements in HR 1. So that FRESH program received $70 million in investments, but that $70 million came from the bridge fund. So that just shows that the legislators had to be very creative in what kind of monies they were investing and what they couldn't invest in. I think coming up into veto session, well, maybe not necessarily veto session, but especially into next year's session, it's going to be after an election. It's going to be, there's a lot of different environmental, what do I want to say? Not environmental, but in terms of talking about the vibe or the climate in Springfield, there's a lot of things that change during an election year, which is this year versus next year. And so, one thing that I think that we will see moving forward that will help some of these spaces is new revenues coming in, if we can get some progressive revenue passed.
Absolutely. Absolutely. And I would say from the nursing perspective of budget and what have you, the field was flat for their budget request needs, which was generally anticipated. But the funding that nursing gets in different areas of the budget really goes towards the pipeline, not only, having more nurses in Illinois, but also making sure that the pipeline for nursing educators is there. Because we know that, we have we have a shortage of providers. But that being said, it was anticipated, but we know that that's going to continue to be an issue if that, continues that way.
yeah, did they do anything to try to help um those staffing needs? Or no, like there are like Foster Alliance, one of our initiatives is M3R, more minorities in medical research. But there's the clinical side, and then there's the pathway side. Youth pathway, that's to get more young people to enter into careers in healthcare medicine. And out of the 15 members of FOSTA, about 8 of us are working on the youth pathways part in some way, shape, or form. But there's just some immediate needs I know, like in nursing. So I
Absolutely.
wasn't sure they were they have they even thought about doing anything to cover that shortage, or are they lobbying hard for it?
So
Well, go ahead. Feel free, Chris, to go ahead.
So I just I think this year was a really tough budget year, like we've talked
Hmm.
about before. So some programs needed to be cut and whatnot. One of the groups that I help lobby for is the community college presidents. And one of the
Hmm.
issues that they um, lobbied for that was cut from the governor's budget was the PATH program funding.
Hmm.
And that PATH program funding helps support community colleges so they can get more healthcare professionals into these pipelines.
Hmm.
And so that was a really big loss for not only the community colleges, but for some of these pipelines, especially in healthcare in the state.
Okay, and that is well, that's bad because there's a huge pathways program that Westside United is involved in with Malcolm X College.
Mhm.
Uh, that and oh well, these are the times we live in.
Yep.
Um,
We-
you mentioned progressive tax,
mhm.
but I know in reality they're never going to do that with elections looming. So, so you think that could be, well, I guess during the next budget session, or possibly even, that little
Mhm.
period when the old General Assembly is still there and you might have
Lame
two or
duck.
three.
Yeah. Yeah.
So there was
Mhm.
some advice, it was something that Judy Bar Topeka told me years ago. She
Yes.
said, Levi, always look at that period
Yes.
because I've seen some
Hmm.
crazy things done. So
Absolutely.
any thoughts, predictions?
That's a crystal ball question, of course, but I think
Mhm.
you hit it on the head that veto session or definitely that lame duck time is when,
Mhm.
we could definitely see some of those conversations becoming more serious. And so I would probably say I would assume that it would be more lame duck than veto session, but really to be determined.
Mhm. Yeah, I
Yeah.
think that the conversations will absolutely continue and will intensify the more and more we get into the next General Assembly,
Mhm.
and then significantly once the next budget comes into play, because we're going to need more funding. So they're going to really be creative in looking at new ways that we can produce revenue for the state.
So
Absolutely.
go
I
Debbie.
was just going to say, and we know, many times bills or pieces of legislation do not pass the first time they're brought up in the first
Yeah.
session. And I would say this progressive revenue, not to say it was something that's not been always kind of having conversations about, but I
Hmm.
think that this spring session it became a louder conversation. And so I definitely think, as
Yeah,
we move
because
forward, it's going to get louder.
I mean, in Chicago, it's very popular. You could almost think it's the only song that's being sung right now. But are they thinking like that in with legislators from Central and Southern Illinois, or is there a state? Because I always try to look at it like, okay, people here
Mm.
are different than the folks from where I'm from down in Metro, at least in terms of like what they support, what they think about. But yeah, I was wondering, is the progressive tax, is that starting to really become popular?
I think it's a conversation. I
Yeah.
think that
Okay.
the redder you get in terms of the districts, the harder it
Hmm.
becomes for legislators to fully support different
Right.
things like that because their
Right.
constituents are different and they think
Mhm.
different and they
Hmm.
prioritize differently. And so it's definitely a conversation that's being had, but I would not say it's the only conversation happening down
Mhm.
here at all. Me being in Springfield and Debbie being in Bloomington, both of us have, Democratic legislators, but at the same time, there are there's definitely a Republican crowd, and I'm right next to a Republican House district as well. So,
Hey, well, wow, we're coming up on time. Any other thoughts, stuff to look at? I always like I personally try to follow, okay, did Kwame Raoul win another lawsuit and we might get something restored?
Same. Yes.
gosh, she's doing a lot of work.
Yes.
Oh
Hmm.
yeah, and well, and his budget got cut. I hope temporarily.
Hmm.
But tell you what, Debbie, Kristin, thank you so much for appearing on this annual show, and I might target you to do this next year too. And in terms of like a setup, next month is Illinois Association of Free and Charitable Clinics month, and we're going to definitely have Laura Starr on. So we'll hear how budget impacts her. We've definitely have some challenges because a lot of people can't afford their ACA insurance payments now. So with that, the weather is actually nice today. Uh, and in real time, we're going to be going on vacation in a couple of days. So I'm really happy. And that's it for Community Pulse. And I'll see you all next month.